Good morning, everyone. I'm Marcia Hovey. I'm the Executive Director of Cadre, and I want to welcome you all to this morning's presentation on the importance of cultural considerations in disaster planning. I will be the access coordinator today, so we do have Otter AI and the Zoom artificial intelligence captioning, so please take advantage of that if you need it. If for any reason it's not working, you can private message me. And or we'll stop the presentation in order to make sure that everyone has full access. And this presentation was brought to you by the Bay Area Urban Area Security Initiative. They fund Cadre to do trainings for the South Bay Hub, which is a multi-county area. And since we're doing them on Zoom, we have a much broader reach than that. So welcome to those that are outside our region. A couple of commercials before we get started. Cadre has been given funding from the California Fire Foundation to do education on what wildfire alerts mean so that individuals in the community know if they see a red flag warning or an evacuation warning or an evacuation order, what they should be doing at those steps. And also we've created a 4-page handout that truly explains in detail what you should do at each of these steps so people can be more prepared. It's translated into multiple languages, and we're also, make sure everybody stays on mute. And we are in the process of making some little mini videos. They're about 2 minutes long in all of the languages that explain about wildfire alerts, about evacuations, about what to expect when you're evacuating, about immigrant support, and about access and functional needs planning. We also have a grant from Public Health to talk about wildfire air quality. And so on our, in the same preparedness section that you're going to look at the resources for the webinar, if you just go click in the library and go to air quality, you'll see that we're adding resources there on air quality. There are places that show the current air quality. There are, we have kind of the big players, the EPA and the Bay Area Air Quality Management District and Public Health and others that have educational materials on wildfire air quality and just air quality in general, including a video on how to make your own air filter that will filter the smoke, adequately filters the smoke from a wildfire that's entering your home, as well as it prevents from COVID should we have another outbreak in the area. So you might want to watch that. It's a nice, simple, cheap way to keep at least a portion of your home filtered to keep the germs out. There's the air quality section on the website. And with that, I'm going to turn it over to Francie Collins, who is the facilitator today and who brought all of these wonderful speakers, subject matter experts into the meeting so that we can learn today about the cultural considerations. Does anyone have any questions before we get started? All right, Francie, I'll turn it over to you.
Okay. First, I want to say that I'm considering everybody that chose to participate today as a cultural subject expert. So I'm hoping that we'll be able to have a really good conversation and share all of our experiences, or start doing that, and lessons learned so that we can all benefit from each other. This is the objectives. We want to, Teresa is going to talk about how the demographics that we've been sort of used to in Santa Clara County for a long time, it was just a program. They've changed a lot while we weren't looking, while some of us weren't looking. And we're going to just run through that and why it makes a difference, where people come from, how they perceive disasters and experience how they respond to things. It would be good to be aware that people are all having their own experience depending on their previous lives, and we should plan accordingly. They won't all be us. And we also want to raise public awareness about the fact that immigrants do have some protections and rights in emergency situations, and it would be good if they knew that before the emergency so that they would know that it's safe to come to a shelter or a resource center. And it's good if we all know that there's certain laws and rules around this for federal and state, and that we should report or we should talk to somebody if we see that not being honored. So for the agenda, we could change the slide, Marcia. Just what I just said. The reason that I wanted to do this today is because not just because things have been changing and we should be aware of who's here with us and their needs, but also with climate change just happening way faster than anybody expected. We know that we're in for some very uncomfortable, difficult times. We know that the planning that we have been doing hasn't even really been working for some populations with the previous normal. And with climate change, things are just going to get increasingly more uncomfortable for the most vulnerable people. And I'm not seeing the change in acceleration of planning and allocation of resources that would make it possible to take care of the vulnerable people as it gets more difficult and uncomfortable. Um, and also to to discuss how we can actually change the plans, the writing, and the protocols to integrate these things in more detail, the specific cultures, to just have them be part of the protocols, to be aware of the needs of certain populations and plan from the beginning to address those instead of waiting until it's an issue. You want to change the slide, Marcia? So, who were we talking about? Um, um, there's a note missing at the bottom of that. Well, I'll read it to you. So cultures, when we say, cultural considerations, it's not just immigrants, it's any group that is more comfortable with each other. We know what this is. They have their own sources. They're a tribe, and we need to find the connection to that group and learn how to communicate with them so that we can. And the best way to do that is to have representatives involved at every level of planning and disaster response. Can change the slide. Oh, I see. Here's the little note. So yeah, as we were preparing this webinar, there are many cultures, and we intend to address all of them in Cadre. We have been working on that, but there is so much material here, and I was concerned that it would be a lot for one webinar. But these are other cultures that we all know about that have, just have their own unique take on things and their own needs. And there's more than this. So we hope that this is going to be the first of many conversations about these things. And we are going to be addressing each of these cultures and other ones that you may suggest to us, because that's what you're here for. So immigrants, just to be clear, there's many different categories of immigrants, and this would include naturalized citizens, green card holders, temporary visa holders, refugees. There's not going to be a quiz at the end. It gets, for people that don't work with immigrants all the time, this is just kind of mind-boggling and it's too much. But just to know that there's just not one group of immigrants, and the status that they have, how long they've been here, the type of visa, where they came from, what their previous experience was, and most particularly, if they're here without documents, is really going to have a major effect on how they respond to an emergency and how they work with us in the recovery, how much trust they have, and how much assistance they will allow themselves and their family to receive if we don't build a relationship ahead of time. Are there any questions so far? You can put questions in the chat at any time too. Marcia will alert me. Everybody good? Okay, so participating with us today, we've got some great people with a lot of experience in these different areas. I won't read them each to you, but they'll be either discussing their own areas of expertise and participating in the discussions about barriers and answering any questions you may have about these communities. Marcia? Okay, and another group that should not be lumped together as we're breaking them out. And there will be no pop quiz at the end, so don't worry about this. I just want to make clear that undocumented immigrants don't all just come across the Rio Grande, or there's in every ethnic group, there are undocumented immigrants, even if it seems unlikely and even if we would never be aware of it. But we should be aware that there is in every ethnic group some people that will be really hesitant to give personal information, to come forward for help. And a lot of them, some people judge undocumented immigrants that they didn't come here the right way. Well, a lot of people came here the right way and through virtually no fault of their own, got tangled up in our immigration system and became undocumented and don't want to leave. And for some people to be deported would be the equivalent of a death sentence. So they're very, very, very careful and cautious about interacting with anybody if they're not sure what's happening. Any questions so far? Kind of whipping through this so we can get to the good stuff. And now Teresa Castellanos with the Office of Immigrant Relations for Santa Clara County is going to talk to us about the demographics of the county and why it matters where people come from. Teresa?
Okay. Good morning, everyone. Good to be here. I'm really glad we're having this conversation. The first time I got to be in this type of conversation was probably in 2010, 2011. The county was getting ready for the 100-year flu, and we were having a campaign. And for the first time, public health asked us to convene immigrant organizations to talk about what could happen in a flu and how we'd coordinate and how we'd respond. And the memory that I have from that point was we're talking about, okay, we have all these places to start stuff. We've published something in 3 different languages. This is the plan. And the immigrant community looks at us and says, oh, you expect us to cover 60% of the population and have no funding and no planning for the diversity of that population? And I was like, oops. So for me, that gave me a very big awareness of the ways that we don't include the immigrant community in our planning and the ways that we assume that things will be taken care of without investing, without creating relationships, without having ongoing relationships to know what's changing, what are the new barriers, what are the new questions that are coming up in immigrant communities. And one of the big things that I've learned in working with the immigrant community for over 30 years is that we tend to think of the immigrant community as like a Peter Pan effect. They're always children. They're always going to act a certain way. And that's not true. Immigrant communities change, immigrant communities grow, immigrant communities expand, immigrant communities shrink. There's patterns that are taking place, and we need to be aware of what is taking place if we're going to serve that community and if we're going to be inclusive. And the pandemic also taught us a lot recently. What it taught us was that some immigrant communities were forced to take care of the United States. Many people were lucky enough to be comfortable at home while doctors, nurses sacrificed their lives. Everyone in the healthcare industry sacrificed their lives on the daily. And then we had another group of immigrants who were the essential workers who make sure that they were picking vegetables, fruit, packing our meat, made sure the grocery stores were stocked, made sure things were being delivered. And these people were forced to take care of us. And what has changed in that context of things that need to be addressed that we learned. And for me as a county employee, because I was a disaster worker for 1.5 years with no training and no one taking care of my mental health, I got to see a lot of things that were really big gaps. I also got to see things that I was very proud of. Um, but we need to make time to learn from our mistakes, learn from what did work well, and make sure that the things that changed, that made things better, we continue to do. Because to me, it's surprising how quickly we've gone back to being what we've always been. And we have kind of really forgotten what took place. I recently read a New York Times book that was published during the pandemic. They asked a bunch of authors to write about the pandemic. So they're really short stories. And as I was reading that New York Times book, and I don't remember, like the Damacron Project or something like that. I can't remember the title of the book. But as I was reading it, I was like, oh yeah, remember when I had to get to know my neighbors? Oh yeah, remember when I had to walk around in the community and get to know my neighborhood? Oh yes, family members were separated and we couldn't even see each other when we were in the emergency in the hospital. And so I think it's really important to remember what we've lived through so we can keep going. So with that, next. So as we talked about, immigrant communities are here in Santa Clara County. We've defined what the immigrant community is, and it includes everyone that was born abroad. I like to use images of people in my presentations when I talk about the immigrant community, because we're talking about human beings. We're not talking about numbers. We're talking about the people that live here. We're talking about our neighbors. We're talking about the people that serve us. We're talking about the people that take care of us. We're talking about our coworkers. We're talking about ourselves. Next. So in Santa Clara County, the total population in 2021 was 1.8 million. Of that 1.8 million plus, 765,800 were the number of immigrants living in Santa Clara County. And so what I will say is that when we're talking about the undocumented community, it's always a guesstimate. It is never the exact number, because we're talking about a community that is in hiding, that does not want the government to know that we're here, that they're here. So it is always a guesstimate. One thing that I will say that we're noticing in the undocumented population, and we get this data from USC, they have an immigrant database, an immigrant portal. I don't recall the title of the portal, but I'll put it in the chat if I remember. One of the data points that we've been recently observing, that when you look at the undocumented community in Santa Clara County, it might be like 47, 48% Latino. And it's like 45, 46% Asian. And so I think what we're not doing in Santa Clara County is recognizing the diversity of the undocumented community in Santa Clara County. And I think we're also, because we all watch TV, we think the undocumented community is people who run across the border. Yes, that is part of the undocumented community. But the undocumented community is also the worker that came to work here in the high-tech industry and got laid off and has a month to find another job, is now out of status. The undocumented community is also the fiance that came to marry somebody and then decided that was not a relationship they wanted to stay in, and they're now out of status. It's also someone that came to visit family members and decided that they wanted to stay, and now they're out of status. So there's many ways to become undocumented, and we need to make sure that we take into account the diversity of that population. So in Santa Clara County, immigrants make up 40.6% of the total population. If we include children of immigrants who are the child, we are talking about 60% of immigrant families. Why do we look at immigrant families? We look at immigrant families because parents are going to give their children what they know. If they feel trust in an institution, if they understand how government works, if that is something that they will use, they will give that to their children. If they are afraid of that institution, if they don't trust that institution, then they're not going to give that to their US born child, even if the US born child qualifies for it. So it is important that we take into account immigrant families, because when we exclude immigrants, that means that many times we are also excluding US born children. Next. So when we look at demographics, and this report was published by the American Immigration Council, I will put it in the link and you guys can check it out. It looks at the demographics and the contributions of immigrants in Silicon Valley. And when you look at Silicon Valley, there would never be a Silicon Valley without the immigrant population. It is the knowledge, it is the work, it is the wealth, it is the diversity, it is the innovation of the planet that we have here in Santa Clara County. And as you know, we can go to any shopping center and pick from 6 or 7 different countries of origin what we feel like eating because we live in that kind of diversity. And so it's really important that we understand who lives here so we can take care of everyone that is here. And my definition of community is that if we live in the same space, we are one community. So when we look at demographics in Santa Clara County, 55.9% of the households in Santa Clara County have at least one immigrant person living there. 22.2 immigrants of Santa Clara County are recent arrivals. They've only been here for 5 years or less. And when we look at longer term immigrants, more than 5 years, 77.8 of immigrants have lived in Santa Clara County for more than 5 years. Also, when we look at gender, for the US born population, men are the majority population. When we look at immigrants, women are the majority population. And I tend to think that we don't also acknowledge that women are the largest population of the largest gender that is migrating to the United States. I think we think of it as men, but actually it's women. Next. And this has been true for probably like 10 years. So when we compare race, US born versus immigrant, we see that in Santa Clara County, almost 40% of the population is white, 28.5% is Latino, 22 is Asian American, and Black is 3.1, and Native American is 0.2, and then we have mixed race with 7.3. If we look at the immigrant population, the Asian American population in Santa Clara County is immigrant is 64.6%. So what am I saying? I am saying that the immigrant population is that the Asian community is made up of makes up 2/3 of the immigrant population. And I think that is something that we are not paying attention to either, because all of us watch TV, and when we are watching TV, they're showing us the Latino immigrant that's running across the border. But in reality, in Santa Clara County, 2/3 of our immigrant population is made up by the Asian community. Of course, it's not like the Latino community. They don't all speak the same language. There's many different languages that are spoken. There could be historical conflict among nations, and we lump everyone into the Asian community category. But 2/3 of our immigrant population is Asian. About 20% is Latino, 12.6% is white, 1.3% is African American. So obviously, when we add up all these percentages, the largest population in Santa Clara County is Asian, followed by white. And then Latino is the third population, but it is shrinking very quickly as it gets pushed out of Santa Clara County. Next. So the top sending regions that send people to Santa Clara County are East Asia, Southeast Asia, India, Mexico, Central America, and the Caribbean, and then the Baltic states and other former Soviet Union regions. When we look at the top sending countries to Santa Clara County, it's India, Mexico, Vietnam, China, and the Philippines. If we look at the workforce, so we've been talking about population, now let's look at the workforce. If we look at the workforce, remember that the immigrant population is 40% immigrant, 40.6% immigrant in Santa Clara County, but it's 48% of the people who are working. So that means that the immigrant population is overrepresented in the workforce, that they're working more jobs than the US born. Next. So when we look at language, and this is a typo because I have region here. So let's go to the next slide. That's what happens when you create things fast. When we look at language in Santa Clara County, the top languages spoken at home, other than English, are Spanish, Vietnamese, Chinese, Hindi, Tagalog, and other languages. When we ask the immigrant community, do you speak another language other than English at home? 87.1% yes, say yes, I speak another language at home. So 20% of the immigrant population is limited English proficiency, which means that they have difficulty with English. And when we look at those top sending countries that are at the top languages that people are English proficient in is Spanish, Vietnamese, Chinese, Mandarin, Filipino, and Tagalog. What I will say is that in my experience as a disaster service worker, when you are afraid in an emergency, you think in your native language. You do not think in English. You are scared and you will think in your native language. And so it's really important that we give people information in their native language. And when you're scared, you want to understand the detail of everything that you're being told. Understanding pieces is not good enough. I will say that in Santa Clara County, we are at the point where we translate the ballot into 12 languages because by law, we are required to translate it into 12 languages. 10 of the 12 languages are Asian languages. So we currently are translating our ballot in 10 Asian languages. I would say 5 or 6 are probably Indian languages. So we are, and in Santa Clara County, we speak about 150 languages in Santa Clara County. Even if you're looking at Latino diversity, I would tell you that in Mexico, there are 65 indigenous languages that are spoken. So we are talking about populations that come with a lot of language diversity. And when people get scared, it's really hard to get them information in a way that they feel comfortable if we are not offering it in a language that they understand. And so I would say that in my many years of working for the county and seeing the way we respond, I see that we do change and we do respond, and obviously we grow. Is it fast? I don't think so. I think we need to get to a point where we are looking at diversity issues much quicker than what we are looking at them here, because what ends up happening is that we can kind of predict right now, even based on diabetes rates, in the next emergency, who's going to be the most impacted community. I will tell you now that it'll be the poorest community, it'll be the lowest income community, it'll be the community that faces more barriers. So we already know beforehand, and that's what fascinated me about the pandemic, is that if we just looked at diabetes rates and who was taking care of diabetes, we would have known who was going to be more at risk during this last pandemic. And so we've been talking about the same thing for a really long time. And I think it now is the time to step up what we are doing. Of course, I am so proud that in the state of California, we've decided that regardless of immigration status, starting in January, you will be able to apply for Medi-Cal. That's really important. But I also want to say that during at least the first year and a half of the pandemic, let's remember that for the undocumented community, there was one payment of $500 for a year and a half if you were undocumented. And so there were lots of ways that we did not include the immigrant community. The other thing that I will say that I was really proud of is that when we were doing emergency response, we were not asking for social security numbers. So that made it more easier for people to be able to accept some of the help that we were offering. And finally, I would say that the way that you immigrate to the United States, which means that the way you enter means you trust government and you expect government to be there for you, or you don't trust government, and it's really hard to convince people to accept help and say, we're different from the federal government, we're the county, we're different from the federal government, we're the state. And so federal government politics impacts everybody, not just the Latino community, impacts everybody. When there is a lot of hate talk going on against immigrants, everyone feels impacted because everyone says, well, I'm an immigrant too. So with that, I think this is the end of my section. Thank you.
Thank you, Teresa. And that's so interesting. I'm sorry I made you talk so fast. I wanted to make sure there was time for everybody to discuss this afterwards. But I do want to add a couple of little things that that I guess reminders. When we're measuring statistics, when we're looking at statistics, it's really important to ask ourselves who's gathering the information, who are they asking, and what did they choose to count? How did they describe it? Because that kind of colors our picture of reality. And I was very surprised to learn that in the American Community Survey, they only count the gender of birth. They have no other category, so there's only males or females. Um, I can understand where they probably didn't want to try to put everything, all choices down there, but they could have had an other, I think. But there isn't. There's only that. And also, I was surprised to find out one of our volunteers reminded me, thank you, Reynard, that Arabs and North Africans are counted as white. And so that's very interesting to me because they do not have the white experience. They don't have the white privilege. They are not white, many of them. It's just interesting they couldn't find a category for that.
And I would also say that as government, you want to mess up any conversation with the Latino community, ask them what their race is and what their ethnicity is, and you just stop the conversation because they don't know what the beef you're talking about. And everyone's going to tell you they're Mexican or Salvadorian or Nicaraguan, and no one understands what race or ethnicity means, and we don't explain it.
Yeah, so anyway, these numbers are interesting, but not the whole picture is my point. And I also find it very interesting that there are laws about voter registration, that there must be translations into 12 languages. There are no mandates about disaster. So it is more important to vote than survive in some cases, I guess. We've been working in Cadre, we've been advocating a lot for more guidance on this because otherwise it just gets down to the basic 2 or 3 languages and everybody else is on their own to figure out what's happening. So with that, I think we are going to have Araceli is going to lead us through some information about the obstacles that immigrants have. Araceli is with Catholic Charities, and she's got many years of experience working with immigrants and undocumented immigrants, trying to bring assistance to that community. So Araceli, you want to take over?
Yeah, I think Teresa had her.
Teresa has her hand up. Thanks, Araceli.
So one quick thing that I do want to add is Santa Clara County is currently conducting an immigrant belonging survey. We ask for no personal information. We don't ask how people entered. We don't ask for emails or addresses. We are asking what are their life conditions and what are their priorities. This is in conjunction with UC Berkeley, and the last day of the survey is Monday. So if you have any friends, any family members, it's really important that they fill out the survey. There are a lot of limitations to the survey, but we need to add to the information that we have. And I'm hopeful that this is the beginning of a conversation that Santa Clara County is having with the immigrant population, because we know the numbers, but we need to know in depth what is taking place. We need to know in depth what are the challenges. And we need to know because we're all going to be facing budget cuts. And it's really important that the immigrant community has a voice. So I will put that link in the chat. And thank you for letting me add that.
Yeah, there's a list of links at the end of this that with articles and resources. So that is one of the links on there. And it's possible for them to do it on paper now, Teresa, before it was only online. Is it true?
Yes.
Teresa, do you know where they're doing providing these service?
The survey is online.
It is online?
It is online.
Okay.
We have paper copies, but we're running down to the end. But if you have any place that you think we could collect something in the next 4 days, we'd be very open to that. The survey will be followed by focus groups. So this isn't the end of the research, but we learned a lot in this survey. And I think the biggest thing we learned was, for some reason, they thought that we could do this all online and it would work. And that is not the case. Even though we've all been through a pandemic, we're still facing the challenges of computer literacy. And so for me, it's been a really big example of how we're still including this. We're still not including people when we do things only online. And a lot of the safety net is now online.
Right now, we're doing outreach for Listos, and we're hitting about 3 to 5. Last month, we did 8,000 families, and it's all in person. Different outreaches. We're out about 2 to 3 days a week. Big events, we're hitting 800 families.
Oh, I wish we had connected earlier.
I know. I was like, oh. So I could
I mean,
check.
they're gonna do a Latino. Public health is gonna do a Latino survey, health survey too. So just letting you know.
Okay, definitely want to be involved with that. Because we're providing the information in regards to where we're going. So if we're going out to South County, and this kind of leads into the conversations that, Francie asked me again. Thank you, Francie, for letting me talk a little bit. So right now, certain languages, over 100 languages spoken in Santa Clara County, homes and official information and translation into maximum of 5. So a couple of things that we've been noticing when there is the disconnect in regards to obstacles that we've been facing. Right now, Catholic Charities is working with all of the storm affected families that were affected in Santa Clara County. So we've been talking a little bit about, the disconnect. The disconnect is there. So we're trying to get the information to the families in a language and for them to trust us. So we're trying to go out to their grocery stores that they're out at, to the neighborhoods that they're out. We even have a list of different locations of actual flooded areas, and we're going out and doing door knocking. Even though we've, like Teresa and Francis mentioned, even though we've all been through a pandemic, and we think that everybody does everything Zoom, and it's not hitting the communities that we need to have that communication with. They can't read, so this kind of goes based on the language literacy, and they can't get to certain sites. Transportation, they don't have transportation, and also I'm kind of guiding it in everything as far as the time. Are they going to take a half a day off to turn in some paperwork, or are they going to put food on the table? So these are the kind of things that we're going and having to do assessments with the families that were affected by the storms. As you all know, if you're in here in Santa Clara County, we're expected a couple more storms in the next couple of months, and climate change is definitely going to be affecting us in the next year. So with that said, we're trying to get the communication out to the families, and we're trying to get the communication in their language. Language is a barrier, especially how do I get that communication to a family that doesn't read or at a certain level of what they're reading. So we're trying to get that information into locations where we're doing areas or like big apartment complexes. So when we're going out to large apartment complexes, we're trying to see, do you know your neighbor? Some people are afraid to know their neighbor. Some people don't know their neighbors, and then there's other communities that know their neighbors well. So we're utilizing different techniques that we've been trying to do here at Catholic Charities to try to get the communication. Who could pick up your child if there is an emergency? Who, if you're a farm worker and you're working in Watsonville, how long is it going to take you to get to your loved ones? Or how do you get that communication if you're in an isolated area where you don't have any technology? So these are the kind of obstacles that we've been working with the families that we've been assisting over the last couple of months. And then they're afraid. When we were working the storms right after the New Year's, they mentioned, their shelters. Well, we found people, and they were afraid to go to the locations where they wanted to have the shelters. Some of the shelters, I know we were at two of the shelters. They asked us to be there for translations. And when we were doing translations, it was simple translations where they just wanted to make sure they were okay to be there. They wanted to make sure that, is this going to affect them in any capacity or any way? Also, what we found out, even in the 2017 floods that happened here in San Jose, we saw families with kids that come to the shelters, but not the working adults, not the parent, not the father. The mothers would show up, but not the fathers, because they would rather stay at somebody else's house, or the mothers are the ones that wanted to make sure that their kids had what they needed. We even saw that in Pájaro, so Catholic Charities. We went out and we've been assisting the families out in Monterey, Pájaro, and we've been seeing a lot of families in regards to, they're just afraid, and mothers we're showing up to the shelters and for their children. That's why they were showing up, because they had nowhere else to go, and they in the shelter, there was about 400 families, 400 individuals that had shown up. But they all had families that were not going to show up to the shelters because they were not close. The shelter was not close to where they worked or where they could try to look for work. They didn't feel comfortable. The communication was not shared in a way for them to understand, because like Teresa said, you tell a person, oh yeah, I speak Spanish. No, there's many different languages, and if you don't translate that information into the correct language in the correct way, it could be offensive. It could be a trigger point for a family not to trust you. So there's been many obstacles that we and many organizations that we've been working with have been working with in regards to this. So just wanted to share a little bit of the experiences that we've been having. But one thing that, on a positive note, with this population that we're working with, we all know that the word of mouth is probably the best avenue that a lot of these families that were affected, they trust that word of mouth. So if I could leave you with a good thing, is when you are working with the community and working with the families that may have had some trauma, or may have had some kind of interactions that they're coming to get some assistance from you. Once they have that trust and gain that trust in you, they will communicate that to more than 10 to 15 of their family members and their own community. That is probably the strongest avenue that we can have, and we've been utilizing. And that's kind of been working. We are on a Zoom call now, but that doesn't work for all communities. Word of mouth, but the word of mouth of trust. But it also could backfire on you if something happens. The word of mouth where something doesn't go well, it could also backfire on you. So you just want to make sure that if you're able to assist them in any kind of way, give them that trust. Showing them that trust definitely can go a long way. Francie?
Yeah. Thank you, Araceli. I want to just give a little example of the word of mouth thing, because it was one of my more traumatic experiences. During the 2017 floods, we opened up a service center, and there was a lot of Asian people. It was I can't remember the facility, but you know, we were sharing it. Of course, FEMA was going to be there in the state and all the government agencies and the CBOs. And so everybody that was going to work there showed up early, of course, parked their cars right in front of the building. All the government cars, all the marked cars were right in the first parking spaces in front of the entrance. And then we opened up, and I didn't, you know, I didn't really log that until I went out to the parking lot. I was talking to Maya Spars out there, and we watched as, you know, several people just walked up and took a look and turned around and left. And we were thinking, gee, what's going on? And we turned around, and some of the workers from the building had gone out, and they were having a conversation in the parking lot, and they were wearing these jackets with a big DHS on the back of the jacket, and they were standing right in front of the door, and everybody just took one look at that and turned around and left. And we knew that each one of those people that had taken a look at that and left was going to go home and tell 50 other people, don't bother to go down there. There's a bunch of ICE people, you know, DHS people there. We were just mortified, and I ran in and told them, you know, take your jackets off, get out of the parking lot, don't move those cars, you know. And but they were in, you know, I mean, it was busy, there was lines wrapped around the block, and there was, and they couldn't really change it till the next day. So that first impression was what we lived with, and we will never know the people that didn't come for help because of that experience. So I just remind, just be conscious way more than you might think necessary of how do things appear, because that's what people are going to go by in the beginning if you don't, before you even open your mouth in any language. So and the other thing that we heard, you know, that can reduce trust is changing and conflicting information from government messages, that it causes people to kind of lose faith in the competence of government, so to speak, and they don't understand, you know, during the pandemic when different cities, and especially as things were evolving, some places said you had to have a mask, some said you didn't, some said you had to be vaccinated. People looked at this inconsistency and decided, oh, well, they don't know what they're doing anyway. You know, I mean, why should I even? And often when people get confused, they do nothing. So that's what we are trying to avoid. And, um, you know, when we be very careful what our message is and work together with the other agencies and the government to be consistent, because people, first impressions are important. So,
I see Teresa with her hand up.
And I would also add first impression and who's there, because I remember the first time there was big fires in San Diego and they were trying to load people on buses. It was immigration that was loading people on buses. And so then we passed a law that said in California you can't be there in the emergency part. So then when the Santa Rosa fires happened and you're checking people in at the centers, again, it was immigration that was checking people at the centers. So I mean, who's physically present is really important about whether people are going to access the services and the information is there depending on what they see. So obviously, yes, those smart cars, but a lot of times it is immigration that is there. They know how to be take advantage of opportunities.
yeah, and I mean, this always makes me very sad. There are immigrant rights. We're going to talk about that a little bit at the end, but one consistent thing that we have learned over the years, disaster 101A, is don't put service centers and shelters in government facilities if you want immigrants to access those resources. And yet we still find so often that those are the places that are the first choice because they're free to use. They're easily accessible. They don't need a special agreement or MOU, although part of planning could be to have a special agreement MOU in place so that immediately ethnic services could be provided in familiar, safe places. But still, over and over, we find that that's the first choice. And I would like to see basic disaster planning on the government level to have that change to the last choice, and try everything else to work with the community to put resources where they will feel safe. Because even if they force themselves to go for the sake of their children or whatever, why should they have the added stress and anxiety of having to be in a place that they're scared, you know, or separated? So,
Francie, I have somebody else with their hand up, Marie.
yeah. What? I'm sorry.
We have
What?
somebody with their
Mira
hand up.
Mira has her hand up.
Mary has her hand up.
Yes, Mira?
Yes, I just wanted to quickly add, at India Currents, we serve a first generation immigrant population, and we've come across all of these issues when we were basically initially trying to disseminate census-related information or pandemic-related information. And in our conversations with the community, just to highlight that this indeed is the case, the lack of immigration status sometimes, or the loss of immigration status, would discourage people from accessing information or presenting themselves at shelters. And also the lack of culturally congruent nutrition was another issue they raised. They didn't want to be eating food that might not be halal or kosher in some respects. And we in our community, we don't have what we call cultural ambassadors, or volunteers who could help spread information. And people are less likely to go online because there's a digital divide in many cases, especially with multi-generation families where the older parents rely on their children to do everything for them. So these are just some of the issues that cause hesitancy, in addition to the ones that you mentioned.
Yeah, Marcia, can you put the slide up of Mira's demographics there? Sorry, Mira, I got your
That's
information.
okay. I mean, I'm happy to answer questions later on.
Yeah. No, here.
Just to address
that's-
that, there's over 12 major languages spoken by this community. So when we were trying to disseminate census information, we actually reached out to influencers who spoke all of these different languages to reach these hidden communities and give them the information and resources that they needed.
Yeah. Sorry. Mira is the managing editor of India Currents, and it's a digital magazine for the Bay Area that has over 50,000 readers. And Cadre hopes to be working with them to reach some of the Indian communities that we haven't already been reaching out to, because I've been concerned about, although there's an impression that there we are, that all Indians speak English. That's definitely not the case. But also there's not just one big group of Indians, as you can see. Well, the slide disappeared again, but okay.
I'm sorry, I'm having technical difficulties. Give me a second.
It's just words. But a lot of the Indian families have brought their parents over. They're at home taking care of their little kids while people are here on, working. These are the people that are less likely to speak English, the elderly. They have no transportation. They have no idea about the American disaster relief or even what kind of things could happen here. So if there was an emergency, depending on what time of day and where it was, it would be there could be a lot of people without a clue of what to do if we don't find a way to reach them through their own communication channels. And that's one of the things that Cadre is working on, is creating a grassroots emergency communication network that helps us to make sure that ethnic communities get emergency alerts and push them out to their own communities in their own language through a source that they trust and recognize. And we can connect to them in that way and get information and resources to them. And that's another way we're trying to build trust in the community. So you could see the different languages that we were mentioning. India, for those of you who don't know Indian history, was not a country. India was created by the British Tea Company for their own convenience. India consisted of like 50 different states with Maharajas. So they had different languages. They still do, different languages and different cultures. So there is no real India, only to us white people. So these are some of the languages in the Bay Area, Indian languages that are spoken. Is there anything else I missed, Mira?
No, I think you got that. It would be like corralling all of Europe and forcing one language upon them to understand, things like climate change, disaster relief. And that's the situation you're facing, with our community in the county.
Yes. So, Mylin, are you here? Marcia, did Mylin sign in?
I have Mylin on, she's on the phone and she's trying to log in with her phone. Okay. And give me just a second and hopefully we can get her in.
Yeah, Mylin is the director of the Asian American Community Services, and she had extensive experience during COVID trying to bring resources to the Vietnamese community because, again, it consisted of a lot of elderly people. The first wave of Vietnamese that came at the end of the war, those people are elderly now. Some of them don't speak very good English still. Many of them don't have transportation. They almost all live in East San Jose in one area that's called Little Vietnam, and they're quite comfortable there. And it's amazing. It's like going to Vietnam. And there's a huge shopping center there that is, very interesting place to visit. And everything is familiar. Everything is bilingual. And it was a long time before Mylin was able to get COVID information and vaccinations into that area because these people did not feel safe to leave. They didn't have a way to go anyplace. But when she finally managed to schedule a clinic there was, hundreds, thousands of people showed up there. There was just the whole community came out for vaccination, and they had to, take names and schedule returns because they didn't bring enough shots. But they wanted the vaccinations. They just didn't know how to get them. Is Mylin on now?
He is dialing in right now. So give me a second.
Can you put the Vietnamese slide on?
Sure.
Just continue until she shows up. I think one of the biggest issues in the community was there was a lot of underreporting. I think this might have happened in a lot of ethnic communities, underreporting of COVID. People didn't want to report symptoms. They were afraid to be quarantined or worse yet, sent to the hospital, separated from their family and their interpreters. More importantly, nobody likes to be separated from their family, but if you don't speak English and you don't know what's going on around you and you have no way to tell people what's happening, it's a very vulnerable feeling, and they did not want to go there. So who knows many more cases there were because people were afraid to report and to receive treatment because they would be separated from their family and their interpreters.
Francie, do you want to go on to the next thing and see if she's able to get on?
Back to Mylin. And we'll have a discussion after so that Mylin can answer questions also. So with the next slide, yes, additional challenges that immigrants might be. One of the things, poverty, pre-disaster poverty, ongoing poverty, which is happening all around us at an increasing rate. And as the different COVID mandates and protections and moratoriums have all evaporated, we're finding a huge amount of evictions. The slight bit of extra money and food stamps went away a couple months ago. Everything is tightening up, for people that were having to, and even though for many people it seems like the pandemic is more or less over, a lot of people are still stuck right in the middle of it. They've never been able to crawl out of the hole that they got into, and climate change is just going to be exacerbating all of that as people, as it gets more uncomfortable. People don't have air conditioners, people don't have a safe place to go. Utility rates are going up. Yesterday I read again, one thing at a time, the low income people are being squeezed until, when something serious happens, they're going to be left with no cushion at all. And we should just know that. We should, it's difficult working within the disaster relief system because you're not supposed to be addressing pre-disaster poverty. You're supposed to be addressing only disaster-related need. But how do you separate out when people start without enough to eat or without a place to stay? And as it says, the disaster relief system in America is based on disaster-related losses that can be counted in dollars. So just being poor doesn't count. And if you didn't have anything to lose, if you didn't have a home, for instance, they're not going to put you back in a home unless it's a shelter or some, they're not going to leave you better off than you were in the disaster because that is considered a misuse of. So at best, people could be brought back up to whatever level they were before the disaster. And usually that doesn't even happen. I don't want to be too negative here, but the system was not written for poor people. So next slide. Yes, developing trust before. A consistent theme is distrust, fear of government and authority, and undocumented immigrants. We've been through that, but as we said, all immigrants are not the same. And for some immigrants, which are going to be, there's going to be a lot of people in the county soon, with the Afghans that were brought here under special immigrant visas. A lot of people are not secure in their visa status. I'll say that. If they are here legally now, they have certain hoops they have to jump through within certain time periods. And if they don't do that, or if they can't do that, then they would become undocumented and could be subject to deportation. And where would we deport to? Or some of the other people that are here. There's no place safe for them. So they're quite anxious and they're going to do anything they can to avoid attention. And the mental health issues, just considering that refugees, a lot of immigrants, they've already left everything they know, a lot of the things that they didn't want to leave probably, and possibly under very traumatic or life-threatening circumstances. And they bring those experiences here and they suffer from the same mental conditions that most of us would if we had been through that. But if it's left untreated because of cultural stigmas, and then there's a big trigger like a disaster, it will cause, some reactions that are not like perceived to us as rational or normal. But everybody, we just know everybody wants to be safe. Everybody just wants to have enough to eat and to, feel that they're going to survive this. None of us are different in that respect. And if you just assume that no matter how strangely somebody's behaving, they're not necessarily mentally ill or dangerous. They're just doing what seems to be the best thing for them at that time, the safest thing. And that's because they have a misperception of our system or whether they're safe with us. So we have to go way out of our way and be very patient and compassionate with people that are having a difficult time relating to us and our disaster relief system. We have to keep inviting and keep looking for ways to make it appear safe and welcoming for them, because we all just want the same thing. We all just want to survive.
Mylin is here now.
All right. Hi, Mylin. Welcome. I kind of went through your stuff, but is there anything you would like to say? Did you
Yes. First of all, I wanted to apologize and I wanted to thank you so much, Marsha and Francie, for giving me the opportunity to be a part of this important meeting. I'm sorry I cannot show my face or my picture because my power was off and I don't have Wi-Fi. So that's why I have to use my cell phone to call in to be part of the meeting. I'm not sure is it my turn to share my story or?
Well, yeah, I kind of went through the obstacles here on your slide. I just kind of whipped through them, but why don't you tell them the experience you had in trying to bring the, vaccinations to the Vietnamese community and how that worked out?
Yeah, so I'm honored to be here today, represent my agency, the Asian American Center of Santa Clara County. So over the past year, as we all navigated the unprecedented challenges of the COVID-19 pandemic, our center has been provide hope and support, especially for the immigrant and undocumented members of our community. So when the pandemic first hit, it was clear that some of our community members were going to be more impacted than others. I spent hours sharing my my thoughts and worries with Marsha. I remember Marsha and we spent a lot of time in talking about what can we do to address this challenge that once in a lifetime that we all experience. We talk about the barriers that the community of immigrants may face, that include language barriers, limited access to healthcare, and economic hardships, were just the tip of the iceberg, especially for those undocumented among us. There was an added layer of fear and uncertainty. They were concerned more about their safety and hesitant to really seek help due to their legal status. I remember even when, when the COVID vaccine come out, many people were anxious to get the vaccine, but then many will hesitate to really come out and get it because of the fear that they afraid that their legal status will be exposed. So what we did was we launched a door-to-door initiative targeting the neighborhood that have the highest undocumented. And then we give out flyers. We organize one of the largest vaccination drive at the time. At the Grand Century Mall, we collaborate with Bay Health Care in the area to provide the vaccinations to whoever wanted to walk in and get vaccinated. It's like back then it was not just now that everybody can get vaccination, everybody encouraged to get it. But back then, even if you want to get it, the vaccines are very scarce, and it's just like, only some will get, but not everyone. And especially, I'm just worried about the senior citizens who are undocumented or who are not really fully documented in some way. And I'm worried for the homeless individuals, and I'm worried for the men who still have to work on the field, like doing janitorial services or other types of services that they are, underdocumented, but they really are the ones who need to be vaccinated. So we organize that event and hope that we can be able to vaccinate about 300 individuals, because that's the only vaccine that we have, 300. But in the morning of the event, I remember I came out around 5 o'clock because Pepsi wanted to sponsor our program by donating lots and lots of water bottle for the event. So I came out early to get the donated water bottle at around 5:30, 6 o'clock. I already see like about 500 people standing in line that early in the morning just to get vaccinated. On that day, we have the total of over 2,000 people show up to the event. But like I say, there was only 300 vaccines available. And then so I beg, and then so the CEO of that Bay Area Community Clinic came out, and he said, okay, then he'll ask his staff to come back to the clinic. They brought out 500 more. Then so we ended up vaccinated about 800 community members on that day. And my heart was so filled with love and hope. And also Francie and Marsha also show up on that day. So we had a wonderful time serving our community. So another thing that, but it didn't stop at the vaccination. We also recognized that the economic fallout from the pandemic was severe. many in our community, especially undocumented immigrants, lost their jobs and had no safety net to fall back on. So in response, we collaborated with local food banks and other organizations to provide broader support. We helped people navigate the complexities of finding assistance, either financial or rental assistance. And we're also ensuring that they had access to food, housing, and healthcare resources. Our approach has always been about more than just meeting immediate needs. It's about building a sense of belonging and community. So during these visits, we listened to stories and share experiences and forged deep connections. And we saw firsthand the resilience and strength of our community, even in the face of such daunting challenges. This pandemic has really taught us a lot, especially for us, for our agency. It has reaffirmed our commitment to serve and empower every member of our community. And we've seen the impact of coming together, of showing up for each other and the difference it makes. I wanted to take this opportunity to really personally thank Marsha and Francie for believing in us. We are a very small grassroots organization. We did the best that we could, and we couldn't be successful without the help of Catherine, without the help of Marsha and Francie. So thank you very much.
Thank you, Marlene. This is exactly our mission. So thank you. Let me see. I'm just going to quickly say, because I put a link in the back, Community Health Partnership did an amazing focus group in May of 2023 with over 500 participants in Mountain View, Gilroy, and San Jose. They did it in English, Spanish, and Vietnamese. And the findings were just, there's no big surprises that we didn't all already know, but it was actually the community saying these things. I'm not going to go through in detail all of this because I want to get to some Syed and some other things, but I just want to say that one of the main things that came up, there's the economic hardship, mental health, access to care. These are the things that it seems like, can you put the next slide, the access to care, Marcia? There. When it seems to us and the general public like there's plenty of help, that there's programs to help everybody, that nobody, if anybody is not getting rental assistance or food or whatever, it's because they don't need it or they don't want it. That is definitely not the case. And this gave us some quantification of that. And one of the most telling things was that of all of the applications for rental assistance in California, 1/3 of them were denied, and 93% of the ones that were denied actually met the income eligibility, and 83% of them, they just were denied because they couldn't get through the application. And this could be language, literacy, just sometimes I find it hard to get through applications. They're not written at the level of, that they would be if they really wanted everybody to be able to fill them in. So one of the things that I would really recommend is, looking at training of ethnic organizations and all the service providers and even faith-based providers on how to fill in these applications, and letting the community have more assistance, hands-on assistance with these, because so many denials were just because they couldn't get through the application. Also, they didn't know what was there because the resource was in the wrong language or coming from the wrong source. There was the fear of public charge, of impact of, but people don't understand. Landlords have a lot of power in a disaster, and if they don't want to cooperate with their tenants or disaster relief people, they don't have to let anybody on the property. Especially in the Red Cross, we've had trouble with, farm labor camps and things. We can't go there and look at it without the owner's permission. And if they don't want anybody to see how people are living there or how they were living before, we just can't offer them anything, because without an inspection, without, verification, they get, bulk food, but not the assistance that they could have So there's a lot of barriers that are just technical and regulatory that people don't really understand. And I think I would like to advocate for those to have more light shined on them. And also when people apply for things with different agencies and they just drop out in the middle, I know that everything was overwhelming and COVID and all, people were understaffed, but it would be good to follow up and just see what happened. Where did you go? Do you need help with the application? Just saying. Next slide. So this is the findings. We don't have to go through them because I put a link to this whole study in your resource list, and it's really interesting. I urge you to go there. They went to great depth of conversation with people about what worked for them and what didn't, and it was just a little window into the lives of people that are having a very difficult time. So next slide. And now it is turned Syed Husseini, who's the Regional Disaster Director for Islamic Relief USA. And he's been a cadre member and worked with us for years. We worked together with a cadre volunteer, Reynad, to prepare a more extensive list of some of the issues that Muslims would face in a public shelter or feeding site. And that's one of your handouts. So, but Syed is going to walk us through the barriers that Muslims face when trying to access disaster relief. Syed?
Hi, everyone. How are you doing today? First of all, thanks to Francie and Marsha and Cadre for putting this together. This is a really good space, and I think we need a lot more of them taking place. And I'm really happy to be with everyone. And I just want to kind of touch on different barriers that communities face in trying to receive disaster relief and disaster services. Kind of want to focus on the Muslim community, but one thing when we're kind of putting this list together, we realized that barriers that the Muslim community faces are very similar to very similar to barriers that other communities will face also. So I think there's a lot of overlap there. We kind of just start, we talk about an unease with law enforcement. I think as we've discussed, even in this webinar, a lot of immigrant communities have a great deal of unease with law enforcement. And I think there was an interesting divide we noticed with federal versus local law enforcement, that when you look at the Muslim population and when you have the immigrant Muslim population that just arrived one generation or two generations ago, there is or the descendant of immigrants, like so people that were born and raised in America, but their parents are immigrants. There's a higher distrust of federal law enforcement. So not just immigration, but just there's been a large history of government surveillance of the Muslim community. So great deal of distrust with the FBI or with larger types of law enforcement from the federal agencies. But interestingly enough, there's been those immigrant populations have a degree of trust with local law enforcement because they view local law enforcement and police as not necessarily trying to surveil their communities. Interestingly, when you compare that to what sometimes referred to as the native Muslim population, or usually the African American Muslim population that's been in America for hundreds of years, these communities generally don't have an issue with federal law enforcement, but have more so with local law enforcement. So it's an interesting divide that what we're seeing a general unease with law enforcement. And I think Francie touched on it in one of her experiences when we try to set up relief centers and it's crawling with law enforcement or people that are visibly law enforcement with shirts and badges and sirens in the parking lot, which can create a lot of distrust and distaste in a lot of people's mouths. So one thing for us to focus on there. The other thing, to jump across the other column there, I want to talk about language barriers and literacy. Even when I was talking about this and I sent this to my initial draft over to Francie, I did put a lot into it because I think, as we've discussed, language barriers is something that crosses different communities here in the United States. And as we've discussed, we have a lot of languages spoken by the Muslim community. We think about, typically we think about Arabic as being the main Muslim language or Islamic language, but only about 20% of Muslims are are Arab, majority are Asian, and speak a variety of Asian languages. If you went back that list of Indian languages, I would say there's Muslim population that speak all of those languages, and a lot of other languages that we find. So language is a barrier, and literacy is a barrier, that we have people that may be literate in another language, but not necessarily have high degree of literacy in English or any other present language. So something to keep in mind, that that a barrier to these communities is language. I think the most interesting thing is that it's the biggest barrier we kind of find is that there's people in the community that don't even know these services are taking place. And that's because our main communication going out is in English or in a language they don't understand. So not even talking about, they don't know what type of services to get. They don't even know this type of thing exists, or where to reach out, where to get this type of information. To get in a few things that are a bit more specific for the Muslim community, when we look at gender customs, so we talked about intergender relations and dress code. In the Muslim for the Muslim community, there's religious dictates that kind of mandate what intergender relations look like. And I was talking this over with my staff, that what will this look like in a disaster setting? So typically, gender mixing is not something that that takes place in a strict Muslim relationship, or in a strict Muslim community. So when we look at mass care settings, and it's a mixed gender care setting, that we have a high school gym with a bunch of cots everywhere, that would make a lot of people uncomfortable in that type of setting, right? So if we were to set up maybe gender separate centers, that might be a little bit easier. And I was thinking about this, but I think this kind of runs us into another issue where a lot of people don't want to be separated from their families. If it's just a couple, a married couple, and they already have language barriers and literacy issues, and you say, now we have to separate you, that leads to a different issue. So I don't know how we would necessarily balance those two concerns, but something definitely to think about. And when I was discussing with my staff, one thing they mentioned was that when you're in a disaster setting, and necessarily maybe you have a table set up in a mark and people are coming up to find out what resources there are, sometimes there may be hesitance for someone to speak of another gender. So if there's a woman may not necessarily want to speak to a man. So if we can make those client-facing spaces, those people at check-in, the people that are giving out the information, if we can create a space where it's very diverse, where there's men and women, so someone who may not feel comfortable talking to a specific gender has other gender options to speak to, that might take down one particular barrier to relief services. To continue down the list, we want to talk about food laws. And I think this was Mira mentioned about this also, that sometimes we're trying to do mass feeding operations, but necessarily dietary requirements are in place. And yes, we talk about allergies. So people have nut allergies, people have gluten allergies, and they're very strict on those. And something to kind of keep in mind about not understanding someone's religious adherence, that people will strictly follow those rulings. So what do I mean? Just like someone strictly who has a nut allergy will not eat peanut butter, similarly, someone who has a religious dietary law saying they can't eat a certain food will just as strictly stay away from that food. So that's something for us to be like, well, this isn't necessarily a halal or a kosher meal, but they're starving, so what are they going to do? It's like, no, just like someone who has a nut allergy won't eat that food. Similarly, someone from a religious background will not eat something that is not in keeping with their dietary laws. So we talked about dietary laws. The main term we use is halal. Halal is an Arabic term which means permissible, something very similar to kashrut or kosher dietary laws in the Jewish community. So certain foods are halal and certain foods are not. We can give a more in-depth analysis of it. Something interestingly that makes halal a bit easier, I would say, compared to the kashrut laws, is that it's not necessarily about the preparation. We don't need a halal kitchen or a halal sink, that type of thing. It's specifically about the ingredients. For the main part, pork and alcohol are not considered halal. And then also there's another degree to halal where when we have permissible meats like chicken or beef, they have to be processed in a halal manner, right? So similar to kosher. And basically, not to get the nitty gritty, basically how it works is if we can purchase and source food that's certified halal and has a halal stamp, and we can print that halal stamp out somewhere and put it on the wall so people are a little bit less suspicious. That would make our jobs as emergency managers a lot easier of getting those services out. If people say, is this food halal? We're like, yeah, it is. I don't know what that means, but there's a sign over there that has a certificate that says halal. People will most likely be like, okay, that's fine. And they'll accept that type of food. In a pinch, what we find is all vegetarian food is halal if there's no alcohol in it. And which is doable. But I think one issue a lot of people run into that our organization does a lot of disaster deployments across the country, recently in Florida, and there was a difficulty in sourcing halal food. So we were serving vegetarian food. And even my volunteers that were doing in-depth, disaster work in the community, they felt that, yeah, I can eat this food, but I just worked a very hard day in like 90% humidity and like 80 and like 95-degree weather here in North Florida. Eating basically a salad and some carbs is not going to sustain me. So we get to questions again of, yeah, this may meet all the rules of halal, but the question of all the dietary rules, but is it something that people will actually eat? There's an article, and I guess I can link that later, but when the hurricane hit New York in that area, so during COVID, the city of New York was trying to do a lot of feeding operations, and they knew they have a very large Muslim population, so they started providing halal meals. They're providing MREs. If you're familiar with meals ready to eat, it's what they use in the military. And a lot of people were saying that this is not. This food is basically a bag of mush. We don't know what it is. It's not palatable. It doesn't look nice. So that's another degree of we can provide halal food, but it's something palatable that people are going to eat and take from it. Another thing I wanted to touch on is fasting. So one of the most, I think, famous forms of Islamic worship takes place is Ramadan. It's a sacred month in the Islamic lunar calendar. When this month comes, practicing Muslims will fast during the daylight hours. And because the lunar calendar, it changes, it moves back 2 weeks every year in the normal Gregorian calendar that we use. So it changes every year. It'll start at a different date moving back. So we can't give you the exact date. That's always in July or something like that. And basically, and when this happens during the daylight hours, people are not eating. So what this means is there is there's a breakfast meal that takes place at sunset, and then there's a pre-dawn meal that takes place. So if we're setting up mass care events and it happens to be during Ramadan, and in this setting, we're seeing that food that we're providing only perishable food between, from 9 a.m. to 5 p.m., something like that, that people will not be able to have food when they're eating because they're not eating during those hours. So we can be aware of when Ramadan or fasting time takes place, and making sure that we have maybe packaged, if we're only staying open from 9 to 5, can we have food that's packaged and non-perishable that we can provide, that they can grab and go, and they can take and store it, and then when sundown happens, they can have their meal, and they have another meal ready when they wake up the pre-dawn, because most likely we won't be having food service at like 5 a.m. in the morning or 4 a.m. in the morning. So they have a packaged meal they can break open and have their pre-dawn meal. Something very similar that a lot of dorms do for Muslim students during Ramadan, because the dining halls won't be open at those times. So they provide them grab-and-go meals. A particular accommodation is prayer accommodations. Practicing Muslims will pray 5 times a day, and typically it's a very it's a pretty internal kind of ritual that takes place. But some things that will be needed kind of help facilitate that prayer service would be just a quiet space, just a quiet open space that Muslims can go and utilize for prayer, and it can be a shared space if they're having I know a lot of airports have they call them meditation rooms or interfaith chapels, right? And typically, they're used once a week by other religious groups, but 3 to 4 times a day during business hours, they're used by Muslim travelers who need to get their prayers in before they catch their connection. So something similar, if we have an open space, and if we want to make it interfaith, we say we have an interfaith worship space that's just an open space that's quiet where Muslims can gather and do congregational prayers. We have a congregational service similar to what Christian faith traditions might have on Sunday, or Jewish faith traditions have on Saturday, with a sermon and a prayer that takes place for Muslims on Friday during around 12 o'clock, 1 o'clock in the day. So it's noontime. So usually we don't think about congregational prayers happening during the weekdays, but for the Muslim community, it happens on Fridays. So that's something to keep in mind if you want to make that available for the Muslim community. And something I think that that I found very beautiful that I see in these shared prayer spaces, and that we've seen in in shared prayer spaces across the world for hundreds of years, is that the same shared prayer space is used by 3 different faith traditions. Muslims pray there on Fridays, and then they clear up, and then on Saturday the Jewish faith tradition comes in and they pray on Saturdays, and they clear up, and then on Sundays the Christian faith tradition comes in and have their services. So I think it's something easy to do. We talk about having a clean space. Muslim prayer rituals require prostration with the face being placed on the floor. So if it's so typically in Muslim prayer spaces, there are no shoes worn because we know that people are prostrating on the floor. So that's something we can kind of allocate for the space. If not, typically Muslims bring their personalized prayer rugs to just pray on in case the floor itself is not clean. If that's not provided, like I said, we were just in a FEMA camp, and most people don't travel with those. We didn't travel at the time with those prayer mats. So they said, here, we have some extra towels, you can use those. So maybe some clean sheets that people can use to pray on would be something that's beneficial. You see here something called something listed as the cleansing ritual. So before these prayers take place, Muslims need to be in a state of cleanliness, and this typically is a washing ritual. This washing ritual is using water to wash basically the face and the arms and the feet, something similar that other faith traditions have. So an availability of water where they can wash themselves. So even if that's a restroom with a sink that's nearby, or having some sort of water space available for them to cleanse themselves before prayers would be something very something that facilitate this type of space. Usually the washing of the arms and the face is not too difficult, but usually it's the washing of the feet that becomes a little difficult. If you're not too flexible, it becomes difficult getting into a bathroom sink, but there's different types of accommodations that can be made. And if we want to talk, move over to the other column, we can talk about concerns over hate crimes or harassment. So we talked about here about DHS warns of more attacks in the US. So a lot of Muslims may feel uncomfortable being in these spaces, especially when we talk about immigrant populations that are very insular and don't mingle with the general population, and may have an assumption that, oh, there's a lot of racist people out there, or a lot of people who don't like me because of the way I look or the way I pray. So that I think it falls on us just to make spaces extra welcoming and having people feel comfortable in those spaces, right? So we talked about even that prayer space that we talk about, making sure that it's not just a safe space, but making sure that it's a comfortable space, in the sense that maybe with a little bit of privacy, in the sense that it's not required that Muslims pray in a private space, but we have found that a lot of immigrant Muslims here feel a little bit on edge, feeling that if they're praying in public, if they're praying in public, they may receive some sort of harassment from unsafe actors in the community. So something to kind of keep in mind, that, oh, this place, the prayer space is kind of open, it makes me feel uncomfortable, and I need to make sure that I pray, so I'm not going to stay in this care setting because of that reason. We talked also about a distrust of the healthcare system. So a lot of skepticism towards the system, and this is, I think, a lot of general skepticism towards a lot of governmental systems that immigrant populations face. And also a distrust about recording information, that I may not necessarily have the right documentation status. So do I want to sign up for this particular healthcare service? And a lot of healthcare services say they're not cooperating with immigration services, but can we communicate that in an adequate fashion through these language and literacy barriers to these particular communities, right? And that's not something unique to the Muslim community, but a lot of immigrant communities. And also, I think a lack of financial resources to be able to pay for healthcare. We might be saying that there's free healthcare here for disaster survivors, but is that communicating in a way where they're like, my shoulder's really killing me, but I don't have $1,000 to spend, and I don't know what that sign says. So how can we navigate this to make them understand that these are resources totally available to them? And then we kicked over lastly to observing Ramadan. So as we mentioned, fasting takes place during daylight hours. So if meals are being served in the daylight hours, it's not something that a practicing Muslim that is fasting at the time can consume. So And if it's perishable food that we're making some hot meals that won't last a few hours, what can we do to adjust that? Can we say that we have prepared non-perishable grab-and-go meals that they can say, oh, you're fasting, there's 2 meals over there, you can take one now for your sunset meal and one for your pre-dawn meal because we're not going to be open at 5 a.m. And then they grab enough for their family. So a family of 5 would need 10 meals. So they would kind of look at it like that. So is that something that shelters can accommodate, specifically in a Ramadan setting for a lot of folks? So I think we talked about a lot of different barriers that a lot of people face, especially the Muslim community. We talked about language barriers. We talked about unease with law enforcement or government agencies. We talked about gender customs and how can these gender customs be met or adapted to make this space a welcoming space for families. And then we talked specifically about food laws, about what halal halal means and halal meals for people, and adjusting for halal meals specifically in a fasting setting or a Ramadan setting, and what that looks like for particular people. This is kind of a trope now in the Muslim community, but I think it's just put it in there. So when Muslims are fasting, that means no solid food and also no liquid foods. So they also can't have any water. So oftentimes Muslims are often asked, no, not even water. And the answer is no, not even water when we're fasting. So something to keep in mind that that no type of consumption takes place during fasting. And we talked also about having prayer accommodation set up. That Islamic guidelines, people are going to be praying 5 times a day, and those prayers are broken up at different times. There's a pre-dawn prayer, there's a daytime prayer, an afternoon prayer, sunset prayer, and an late evening kind of prayer that takes place. So having spaces available for folks to gather together and pray. So people can pray individually. It's recommended religiously that communities will pray in a congressional manner. So if it's a family of 5, those people will probably pray together as 5 people if we can provide a good accommodation for them. And then on Fridays, there's a congressional prayer that takes place, the weekly prayer that has a sermon with it. And then that's generally how we can kind of accommodate them. Interestingly, one last thing that kind of comes to mind is chaplain services and how Muslim communities will interact with the chaplain services. I'll take this time to give a shameless plug for Islamic Relief. We've recently set up a corps of disaster chaplains. We're trained through NIDIS, National Disaster Interfaith Services. They're certified. They're community members who took a training. Now they're certified as disaster chaplains. This corps is located throughout the country, so maybe we can start utilizing them in mass care settings. But the reason we thought this was interesting was we take a cultural sensitivity training. In that disaster chaplain training, we learn about different faith groups and different groups that we might encounter. And then one thing that the Muslim community was kind of came to the forefront was how accessible are these chaplains in this setting, right? So oftentimes we found community members, they go to a hospital and the hospital chaplain drops by and says, hey, can I speak to you? And we know that most chaplains follow chaplain regulations, but there's no proselytization taking place. But if someone shows up to your hospital bed, or they show up to you at your mass care setting, and they're wearing a religious vestment that visually identifies them as being part of a specific faith tradition, and usually in America when we see chaplains, they're usually from the Christian faith tradition, and they visually look like they're dressed as if they're part of a type of Christian clergy, it'll make it very hesitant for non-Christians or people not from the Christian tradition to accept the chaplain services, even though that you and I may know that this person is not trying to convert anyone or proselytize. A lot of these communities feel at unease. We're like, what is this guy doing here? I see his, I see their vestment, I see their collar. What do they want to talk to me about? No, I don't want any services. So making chaplaincy very accessible. So in that training, we talked about not wearing religious vestment or something that can particularly identify you as a particular religious group when you're sending your chaplains out to meet with folks. That's the general barriers or possible barriers we had to services and relief services in the Muslim community. And as I mentioned, we saw a lot of overlap with other communities, immigrant communities here in the United States. So thank you so much. If anyone has any questions, I'm more than free to kind of lean some insight there.
Thank you. Thank you, Syed. This is, I think, this is really a illustration and reminder that spiritual and religious issues become even more important to people after a disaster. And almost all of these barriers, like we didn't have time, of course, to run through all the religions. We were just trying to make the point that all of these could be really mitigated with just some basic training and understanding on the part of disaster responders, so that it's not a surprise to when somebody asks for halal meals, they know what it is and where to get it. Um, Everybody doesn't have to learn the ins and outs of every religion, but just to be aware that it means so much to let people know that you respect their needs. And in a disaster, it may not be possible to have a special prayer space, or especially in the beginning, you know, everything is harder in the beginning. But for people to know that as soon as possible, it is in the plan and on the agenda to start feeding them at the right times, the right food, and recognizing the other needs they have besides immediate disaster relief. So I'm hoping that we can all review our plans and just write this in so that it's added to the training, so that we don't have to act like it's the first time we're doing things every time. So this was my my concern that we would run out of time. I'm just going to mention, can you do the next? Thank you, Marcia. So immigrant rights and disaster, there's a link in your handouts, and you can all read this in more detail, but basically there's a federal executive order that Biden made. There's protected spaces for immigrants, not just in disaster, but definitely all disaster services, shelters, distribution sites, service centers are, there's not supposed to be any immigration activity there. And if there is, we should report it. There's very few exceptions if it's like a serial killer they're looking for or something, but you know, basically it should be safe to go to those places. And there's also a long list of other places with essential services that immigrants should not be bothered by federal immigration authorities, like childcare centers, religious centers, you know, healthcare facilities, religious facilities. The link is there, you can read it. We have this handout in many languages on the Cadre website, and we would be happy to post more languages if anybody would like to help us translate in some more languages. That's our goal, is that everybody can understand the same, have access to the same things. And I just asked briefly for a couple minutes if there's any quick questions, and I can only say we wanted to run through the how unhoused, LGBTQ, the other cultures, because they are just as important. And we have just a kind of a teeny brief list up here. And again, people may or may not be aware of these things, but we are hoping that we can schedule more conversations along this, because we have not had time to receive your wisdom and experience. And in a minute, we're going to have to wrap up here. But if there is anything that you could put in the chat right now, if you had one phrase or word, what could be changed or improved from the system that we have right now, if we were to activate at this moment, knowing what we know now about these cultures, what would we do wrong again? You know, how would we have a deja vu of the mistakes or the lessons learned? Because we don't seem to change our plans based on the lessons we've learned over the years. So please feel free to share your wisdom with us. We will use whatever you say to us. Also contact me or Marcia at any time, because we're planning future workshops and we want to do what the community needs. Now I'm going to turn it back to Marcia.
Yes. Yeah, thank you, Francie, and thank you to all of the speakers. This was great information. This will not be the last meeting we have, because we need to create some recommendations and guidance documents so that we can help the shelter teams be able to accommodate as much as possible. And you're right, Francie, it just takes thinking about it ahead of time.